Good morning, this is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist. Happy Friday to everybody. Yesterday talked a little bit about inflammation, bad oils, insulin resistance. So I wanted to continue on with that because I think a lot of people, when they think of inflammation, they just think of aches and pains, neck pain, back pain, sciatica, headaches, and not to say just those kind of pains, because those are bad pains and those are significant symptoms. But also with inflammation, you can have inflammation all over the body, systemic. So it can be in the gut, it can be in the brain, it can be in other organs and glands. So it's important to know kind of what causes the inflammation and then what things you can do to get rid of it, not just for aches and pains, but for everything else. So we talked about yesterday the inflammation. We talked about what's causing that. So one of the main things that causes that is rancid oils. So yes, it doesn't sound very appealing, but rancid oil. So when we think of oils that are bad for us, we have peanut, canola, sunflower, and we think of, so where do we get all these oils? Well, in restaurants for sure, when we eat fried foods. So say fries, pizza, mac and cheese, processed foods, even in packages of sometimes trail mix and nuts and things like that, or even sushi. They put oils in there to help preserve it to some degree. So there's lots of times where things like that are hidden and we wouldn't really think about that. But think, again, inflammation, not just inflammation, but also, like I mentioned yesterday, causing insulin resistance. So if you are pre-diabetic or diabetic, you know exactly what insulin resistance means. It means that your body cannot have the ability anymore to take sugar from the blood and put it into the cells. So when we have insulin hanging around and it's not going away, that's basically what we say, insulin resistance. So the cells are here, we're trying to get the sugar into the cells, and the cell's like, nope, we're not having any more of that because we're seeing which is insulin, around way too much. As long as insulin is hanging around, we have no chance to burn fat, absolutely no chance. So inflammation and insulin resistance, they go hand in hand, right? People do care about aches and pains, but people really care about weight and weight loss and things like that. So if you're stuck with not being able to lose weight, then you have to look at the inflammatory side of it. You can't just work out more if you're eating bad. If you're eating all these bad oils and you try to work out more, an hour, 2 hours, 3 hours a day, it just doesn't work because you have all that inflammation in your system. Okay, so we know now about the bad oils. So what are the good oils that you can take instead? So replace the bad oils with coconut oil, EVOO, extra virgin olive oil, avocado oil, and macadamia oil. So you can find all these at the grocery store, at the HEB, but think about replacing the bad fats with the good fats. So those good fats will not give you inflammation. And we need fat. Your brain's made up of 60% fat. We need it for hormones. We need it for a bunch of different things. So remember that. Inflammation, not just aches and pains, but also insulin resistance. If you're having issues losing weight or you're stuck losing weight, that could be a big part of it that maybe you've never thought about that before. Again, I'm Dr. Tyler Hamel. Hope you guys have a great Friday and a great weekend. If you have any questions, put them in the chat box below, or you can always call our office, 281-360-8387. We are open again for the last couple weeks, seeing patients. So give us a call if you need us for anything, aches, pains, nutritional consultations. That's what we're here for. And you guys have a good weekend.